So this is one of my patients, Amy. He actually started seeing me because she was having pain on her left hip. The x-ray showed she had mild to moderate arthritis. Prior to the procedure that we did here, we had tried a steroid injection, and then we tried a total injection, which provided relief for short-lived. We try to avoid doing steroid injections because it actually harms the joint more than the good that it does. Temporary, and it just accelerates the breakdown and degeneration of the joint. So with her, what we did was a procedure called a microfragmented fat procedure, where we harvest the fat from the patient, and either from the belly or the lower back. That fat, we process it, and once we process the fat, we can go ahead and inject it into whichever area we're treating. With her, we were treating hip osteoarthritis, but we can use it for tendinopathies, for tendon tearing, like I said, for a rotator cuff that patients want to avoid surgery. So that's an option that they have. So, there are other things that you can do, but that's what we did with her. So we chose to do microfragmented fat. Microfragmented fat is known to have a high concentration of stem cells, which actually change the immune environment of the joint. They decrease pain, inflammation, and they also decelerate the breakdown of the joint. So it actually preserves the cartilage in the joint that the patient has. So with her, we did it about a week and a half ago. And she's already had about 50% improvement in her pain. She's able to walk a lot longer, pain-free, that she was limited by before.
Well, originally I went to Dr. Vega for my shoulder, which was frozen and rotator cuff tears. Then the issue came up with my hip, my left hip, that it felt like it was bone on bone. And I was told by another orthopedic that, you have arthritis in both of your hips. So he actually told me about this procedure that he was experimenting with, new technology, where they take fat, spin it down, and then inject it into the joint. And how the procedure is supposed to work, it's supposed to give it, the immune system is supposed to work with the fat to kind of stop the arthritis from breaking down even more, getting worse. And, and he said, would you be interested in that? And I said, absolutely. I said, I want a day where I don't have to wake up in pain. And at that point where I was so desperate, I couldn't even walk 2 car lengths without stopping because it hurt so bad. I went through the procedure, and it was just, it's a night and day difference. I can walk maybe 4 or 5 car lengths now without having to stop. I am not in any more pain than I was before. And it's just a night and day difference. The only other option was the cortisone shots, and he explained to me, which no other doctor ever explained to me, if you're doing the cortisone shots, you're just masking the problem and you're making the problem worse. It's just gonna break down even quicker. It's not fixing the problem. He is a godsend. I don't know what I would have done if I didn't meet him. It's like, that is what a doctor is supposed to be. He's supposed to take the time, explain things to you, tell you what the process, what your body's going through, and what are your options. It's like, I've never met a doctor like that before. It's just unreal. It's like, I would recommend him to everybody and anybody that I knew. Set up an appointment with Dr. Vega. Do a consultation. See if he can help you, because he doesn't really want to have surgery. So he's doing the physical therapy at the moment. But, I don't know how far advanced he is in his condition, but set up a consultation with him. You know, you can't lose. And I said, and he will explain everything to you.
So it gives us great pleasure and satisfaction to be able to change a patient's quality of life, just to hear them tell you after the procedure that they're able to get back to doing activities that they couldn't do before.